In this video, we're going to introduce a group of exercises to get rid of that nagging pain on the outside or the inside of your elbow, often referred to as tennis or golfer's elbow, which is medial and lateral epicondylitis. Now this injury, it's a repetitive stress or an overuse injury to the tendons that attach to the outside and the inside of the elbow. These tendons attach to the extensor and the flexor mass of the forearm. These are the muscle groups that help cock the wrist up and down and play a large role with not only those motions, but grip and rotational activities as well. Now, a lot of different people deal with this injury. It can due to repetitive stresses that you have in your everyday life, such as typing or writing or carrying objects, due to heavy labor from an occupational demand, or even just your recreational and sporting activities. Because it's an overuse injury, a lot of what you need to do is identify what that provocative activity is, find ways to modify it or take some time off if necessary, but there are some key exercises that you can do to help speed up your recovery. Now, the difficult part with this injury is that one of the main things you need to do is strength training to build up strength of the muscle that attaches to the tendon. If we have more strength, we are able to tolerate whatever that task is that's already painful. The hard part is most of the strength training is uncomfortable to do. So the easiest entry point is doing isometric activities, which means you are holding a position but not moving within that position. One of the things that you can do to work on wrist extension strength, which the wrist extensors are on the top or the outside part of the elbow and attached to the lateral or the outer aspect, is to take a weight. And this is a 5-pound weight. I wouldn't go any lighter than that, but I probably wouldn't go above 10 pounds to start. And you're gonna bring the wrist up so that the knuckles are angled up towards the ceiling, have the wrist hanging over the edge of the table, and you're just gonna try to hold this position. Depending on how symptomatic you are, you may start off with only a 5 or a 10-second hold, but the goal would be to work up to a 30-second hold. Now, the other position, if you're dealing with pain on the inside of the elbow, is to flip the wrist so that the palm is now facing up. With this, you're going to do the same thing by cocking the wrist up, trying to get the knuckles towards the ceiling, and holding this position again. Start off with something easy, 5, 10, 15 seconds, work your way up to 30 seconds. When 30 seconds becomes easy, you can work on increasing the weight. Now, the next progression from an isometric is considered an eccentric activity. And this is the lowering portion of the task. So if you're starting in that cocked up position, and note that we're working the wrist extensors right now, which is going to stress that lateral aspect of that tennis elbow. From this cocked up position, you're going to slowly lower the weight down. For people who are just starting off, you may only go to that neutral or parallel position to the ground. If that feels comfortable, you can lower beyond that. Use your other hand to bring the wrist all the way back up, and then slowly lower again. Now, when I say slowly lower, we're thinking of like a 5-second descent to get from this top position all the way down to the bottom position. Rest on the way up, let the other hand do the work. Repeat for a set of 5, work your way up to a set of 10. You can do the same thing if you're dealing with medial elbow pain from this position. Start with the wrist up, slowly lower down on a 5 count until the wrist is aimed down at the ground. Use the other hand to help assist it up. When isometrics are easy, and eccentrics are easy, meaning you can control the weight and you can tolerate it, then you can work on going through what they call an isotonic, which is the concentric and eccentric, so the lowering and lifting portion. And this just looks like a traditional strength training move. So you are not only going down, but you're also using that same arm to bring the weight back up, as opposed to using the other hand as we were to assist it. With this, you can just go through a traditional set of 8, 10, or 12 repetitions, going at a controlled pace, 1 to 2 seconds on the way down, 1 to 2 seconds on the way up. Go for a set of 8 to 12. Try to repeat for 2 or 3 sets, giving yourself about 30 to 60 seconds to rest in between sets. You can do the same thing from the other direction if it's medial elbow, where you're starting with the palm up, going down, and then bringing the wrist back up. So the motions of going up and down with the wrist, or extension and flexion, those are going to be the two motions that primarily target where that issue is. But there's another group of muscles, your pronators and supinators, that work hand in hand with those two groups of muscles. And the pronators and the supinators, they help out with this rotation or the flipping of the palm up and down. So to work on this, you don't even need a weight. You can get something lighter than that. This is just a PVC plastic pole, and you can work on, just like in the other exercise, isometrics first. So right now, the weight of the pole is trying to twist my hand down. And I'm just keeping the pole parallel to the ground and seeing if I can hold this position. The other direction that you can do is with the palm up. And again, the weight of the pole is trying to twist my hand all the way down. We are just isometrically holding in this palm up position. If you can get 30 seconds and you feel under control, you're not getting a significant increase in pain, then just like the other exercise, we can go into our eccentrics. So we can work on starting with the pole in a vertical position, slowly lower down for a 5-second count until it's flat to the ground, and then use the other hand to help bring it up. Do this for a set of 5 to start with 5-second lowers, working your way up to 10, and you can do this both directions. So working with the palm going down, also working with the palm going up. When that is easy, then you can try to go side to side. And this is that isotonic motion that we were talking about earlier, where it's not only the lowering, but also the lifting component. I like using this lighter but longer object because it gives you a lot of ways to get variety with the exercise. If it's too hard, simply hold more towards the middle of the object, and that'll balance it out a little bit easier for you. It'll be less weight that you have to control, which will make it easier. You can do the opposite to make it more challenging, and you can hold more towards the bottom of the pole so that now you have a longer object that you're trying to manage as you're rotating side to side. And that added length to the object is going to create a little bit more resistance or a little bit more torque around the elbow that we need to control. If this feels too easy, then you can transition to an actual weight, and you can just hold that weight and do the same motion, but with something that has a little bit more resistance with it, working up to whatever is more challenging. So the third group or categories of exercises that I like to look at, and we've looked at flexion and extension, we've looked at pronation and supination, we also need to consider grip as a key ingredient to our strength training program for anybody dealing with this injury. Now, grip comes in a variety of different ways. We can grip a smaller or a larger object. We can grip with our entire hand and all of our fingers, or just one or two or a group of them. And we can also think about the orientation of our hand. Are we gripping with a closed fist versus do we have more of a straight finger or more of a pincer type grip? All of those different types of grip are going to stress different areas of the elbow and the forearm. And we talked about the flexor and the extensor mass. That's not only made up of the muscles that move the wrist, but also the ones that move the fingers as well. So it's not uncommon for people to have grip deficiencies with this injury. Now, the easiest way that you can work on this is just getting a weight, and I have a 5-pound weight. This is probably too light for most individuals, and you could go with something heavier than this, but you can work on just placing the object on something, stepping up to it, getting a firm grip, lifting the object, and just trying to hold for as long as you can tolerate. If you can hold for 30 seconds, then you can work up to a heavier weight. If you can't hold for 30 seconds, then just hold for as long as you can, and then simply place the weight back down when you're done. This is an early phase activity that I'll do with individuals to get them comfortable and also confident holding heavier objects. Things to keep in mind is we want to keep the object close to our body. We don't want to have it far away. And we want to have an easy exit strategy, meaning how are we going to get rid of the weight if it's uncomfortable or we can't hold it any longer? Now, the other options that we have is getting something just of a different size. In the gym, we often use the plates because it's going to be a thinner grip and it provides different options for holding. So two different things that we'll work on is more of a flat finger grip where you are holding the plate this way and doing the same thing where we try to hold for an extended period of time, working up to 30 seconds. In addition to that flat finger grip, we can bend the fingers and think about holding it with just our fingertips. We're going to have less surface contact with this. It's going to be a little bit more challenging. And then if we really wanted to get more advanced with it, we could try holding with just two fingers, and you could pick any two. So it can be the first two, it can be the middle two, or it can be the last two. And then you could even make it more challenging by just trying to go one finger to hold on to it as well. You can do the same thing with a dumbbell. So if you don't have a plate available to you, you can also do this with a dumbbell where you just hold the dumbbell vertically. And you can hold either with flat or fingertip grip, and you can have any combination of what you're using to hold on to that weight. So with these, those are three simple categories of exercises that you can do in that early phase golfer and tennis elbow. We can work on wrist extension and flexion, we can work on pronation, supination, and we can work on grip. At some point, that's going to get too easy, and we got to make it a little bit more challenging. So let's head over into the gym and we'll talk about how we can introduce pushing, pulling, and carrying exercises to add a little bit more resistance, make it more of a total body movement, and start to integrate more tasks that are going to be functional in nature to help you get back into the gym or just your daily work and activities of daily living. All right, so the three different categories that we'll talk about will be a rowing exercise, a pressing exercise, and a carrying exercise. And we're going to go through an example using a dumbbell and also a kettlebell. The kettlebell is going to provide a little bit more demands from a stability standpoint, so the dumbbell tends to be the easier way to integrate it. From a rowing position, there's a variety of ways that you can do a row, but the one that we're going to show is a bent over row supported with a bench. So with this, we're going to have the weight down by our side, starting with a straight elbow, and my wrist is neutral, meaning it's not cocked in, it's not cocked out. Palm is facing in, and we're just going to pull straight up, coming up to our ribs. With this, you want to keep a controlled tempo, and if we want to make it a little bit more challenging, we can add a rotation. So we can start with the palm down, facing back towards us, rotate up so the palm is forward. With this, we're starting to get some of those rotational demands that we talked about earlier when we were on the table. Now, we can do that same activity with the kettlebell. With the kettlebell, what we have to keep in mind is it can sway side to side. So even though the weight may be consistent with the dumbbell, there's going to be a little bit more demand from a stabilization standpoint. But the movement stays the same. We can go straight up and down, or we can add a rotation with it. With these, treat it like a traditional strength program where you're doing 8 to 12 reps, 2 to 3 sets, and keep a controlled tempo on the lifting and the lowering portion. Now, getting into the pressing, we can use these same weights using the same bench. So with the pressing, it's just going to be the same general motion, but we're going to be going the other way. So we're going to be lying on our back on the bench. I'll start with the dumbbell, and I'm going to start with just a straight press. Palm facing in, just like it was for the row, and then I'll transition to more of a rotational press. Then after that, we'll show the same thing with the kettlebell. So with the dumbbell, you can go both arms or one arm at a time. I'm just showing one arm at a time for the video. Start with our elbow by our side, pressing straight up and down. If that feels easy, you can add in a rotational component where as we're pressing, we're rotating the weight in and out. We can also kettlebell, and there's two different ways to use the kettlebell. We can have it resting on our forearm, or we can have more of a bottoms up component to it. This is going to add a lot more stability demands. Same thing, we can press with a rotation, or we can do the bottoms up, where we may have to slow down a little bit to provide that stability, and we can add the rotation with it. With the pressing and pulling, you're going to be working the forearm because there's a heavy grip component to it as well. And because we're pulling and pressing, we're getting more muscle groups involved. So we're able to move a little bit more weight, a little bit more resistance, which should help carry over into more functional tasks of daily living. Now, let's transition over to the turf. We're going to bring the dumbbell, we're going to bring the kettlebell, and we're going to show you different farmer's carries variations that we can use to really ramp up the resistance and get a little bit more grip demand. So the last exercise we'll talk about will be farmer carries variations. And the nice part about this is it allows us to get a little bit heavier of a weight, but we have to manage that weight as we are moving. So it's a very functional activity. With this, I've got a 45-pound dumbbell, I've got a 28-pound kettlebell, and I've got a 53-pound kettlebell. We're going to start with the dumbbell. And with the dumbbell, picking it up, you can do one arm or both arms. Keep in mind, if you only have one, it may try to tilt you to the side. So you're going to have to counteract that to keep yourself upright. Don't worry about having the weight very far from the body, but try not to let it bump along your side as you're walking. From here, try to keep the weight as steady as possible. Don't let it sway or swing as you're walking down the turf or whatever you have accessible to you. From there, turn around, go back to where you started. Big thing here is making sure we are not letting the weight control us. We're keeping it just slightly away from the body, and we're not letting it swing or use momentum as we're walking. You can do the same exact thing with a kettlebell. Keep in mind the kettlebell is going to want to sway a little bit more, but the idea is the same. Keep it just off the thigh. Try to keep a vertical, upright position as you walk down and back on the turf. When we get back, we're going to get one of the lighter kettlebells and we're going to do a bottoms up carry. Now with this, the stability demands are a lot higher. It's also going to be much more challenging on the shoulder. So keep that in mind. If you have any shoulder injuries or anything else that you need to be considerate about, make sure you pick an appropriate weight. We're going to start with the kettlebell up, trying to keep the elbow at 90 degrees. Walk with as minimal sway as possible, and you can also progress to going overhead. If we go overhead, the weight is further from our body. Going to be a lot more stability that we need to be mindful of, and you may inherently slow down your tempo just so that you feel safe and under control. Our turf at our clinic is about 25 to 30 yards long. We'll typically start patients off by walking from one end to the other. As they get more comfortable, we'll do full laps where they go all the way down, all the way back. At home, I often have people use their hallway as a really good reference for that, or if they have a driveway or sidewalk outside, that's safe and accessible to use. So in summary today, we talked about tennis and golfer's elbow, which is also referred to as lateral and medial epicondylitis. This can be an inflammation of the tendon or just a degeneration of the tendon from chronic repetitive stress and overuse. Those stresses can come from sporting activities, work-related activities, or just activities of daily life where we're doing the same thing over and over and over. The first thing that you need to do is be mindful of what brings on the pain. And when you can identify what those activities are, the first thing that you should look at doing is trying to modify those activities. See if there's anything that you can do to make that environment or that task friendlier for the elbow. If you're unable to modify it, then you may need to look at taking some time away from that activity or minimizing how much of it you're doing as you're allowing that area of the body to heal. You can seek out healthcare providers to see what the extent of the injury looks like, if there's anything that they can offer from an over-the-counter or prescription medication to assist with either the pain or inflammation, or to make sure that we're ruling out any other issues that could be happening at the elbow that may involve medical imaging from a diagnostic standpoint. If you seek out a physical therapist, they will do a variety of things to help manage your symptoms. They may do soft tissue work, they'll show you some different stretches and mobility drills that you can do, but strength training is going to be a large part of that rehab protocol, and hopefully watching the video today, you get an idea of what some of those exercises may entail. If you found this video helpful, please like, subscribe, share with your friends, and stay tuned next month when we tackle the ankle.